Good morning. Thank you all for being here, those of you in person and those of you online. I certainly appreciate it. I want to begin this morning by saying thank you to the men and women in uniform behind me. I have to thank each and every one of them and all of the colleagues that they represent for everything that they do every single day to keep us Mississippians safe. When it comes to law enforcement, these men and women represent the absolute best of the best in our nation. Mississippi's law enforcement officers have been through a lot over the last couple of years. But despite it all, they have endured. Well, actually, they've done a little more than endure. They've excelled. They had to bring the same level of professionalism day in and day out, despite a litany of dangerous rhetoric by politicians and talking heads about those who serve in this profession. Broad, sweeping characterizations about who they are and what they stand for simply based on their line of work. Some have called policing inherently and intentionally racist. There were calls to defund the police, to dismantle them, and claims that doing so, at least in one case, would, quote, get rid of the cancer. Some politicians even said they could imagine a future without the police. There's really no other way to describe it. Some of the language that has been thrown around at them has been downright crazy. And in some cases, it has made their job even more difficult, and it has made their job even more dangerous. Today I come to say to all of the law enforcement officers in our state, I'm incredibly sorry you've had to put up with that talk and that rhetoric. I'm sorry you've had to deal with politicians around America and talking heads who have no desire to understand and learn more about you and your profession. I want you to know that as long as I'm governor, Mississippi will always have your back. My administration will do everything in our power to ensure that you have the resources and the support that you need to do your job safely and to do it effectively. As long as I'm governor, Mississippi will continue to back the blue. And as if this assault on law enforcement profession wasn't enough, they've also had to deal with the global pandemic. You see, these men and women behind me and the people they represent, they didn't have the option of telework. They couldn't work from home on a laptop. No, instead, they've done what they always do. They get up every day to protect and serve our communities with honor. Day in and day out, they put their own health on the line to keep us safe. I want all of our state's law enforcement officers to know that my administration and our residents recognize the sacrifices that you've made over these last 2 years. We are incredibly proud of you and everything you've done. We are lucky to have you, and we will always appreciate you. Something that really stood out to me over the last 2 years was our officers' attitude. They never complained. They didn't feel sorry for themselves. They didn't give up under the intense pressure. Rather, they stepped up and they stood strong. They were role models. They proved to people what being a law enforcement officer in Mississippi was all about. Our state could not be more pleased with their efforts over the last 2 years. Due to the hazardous duties and mountains of challenges that they encountered, I have authorized $1,000 in hazard pay, funded by my office's discretionary CARES Act funds, for each sworn law enforcement officer who actively served during the COVID-19 state of emergency and who was employed by state agencies as of November 30th, 2021. Our state law enforcement officers will receive this hazard pay by the end of this calendar year. This one-time payment at Christmas time will be a small recognition of the service of those who put their safety on the line every single day. Now, we'll never be able to fully repay our officers for everything they've done for us over the last 2 years. We'll probably never be able to fully repay our officers for the increased risk of being exposed to COVID while performing their duties throughout the pandemic and throughout this state of emergency. But here's one thing that I can guarantee you. We're never going to stop trying. Everything you've been through over the last few years merits this hazard pay. You've earned every single penny. Again, I want to personally thank the officers who could join us today and to all those serving our great state. At this time, I'm going to turn it over to our Commissioner of the Department of Public Safety, someone who has advocated for this hazard pay for many, many months, and someone who is going to introduce one of our state troopers to say a few words. Commissioner?
Thank you, Governor. Good afternoon. First and foremost, I would like to thank all the members of law enforcement that make sacrifices on a daily basis to protect our communities, our homes, our family, and our friends. It is a job that never sleeps and one that entails the utmost sacrifice. So thank you for all law enforcement. I'd also like to thank Colonel Randy Ginn, Mississippi Highway Patrol. It was with his leadership and his vision and his knowledge that I was first learned of hazard pay and its availability for law enforcement in Mississippi. And I'd like to thank our governor. I can tell you that Governor Reeves has always answered the calls that I have made for support of law enforcement. He has put the weight of the governor's office behind that support and driven issues day in and day out to help support law enforcement. And when I brought this to his office, he wanted to do it right away. And I'm so happy that we've been able to do this at this time of year to help support law enforcement officers and their families. I met earlier with one of our troopers, M8 Trooper Craig James. Talked a little bit about his family, his daughter Olivia and their son Rhett, and talked about the impact that it's going to have on them during this time of year, because the reality is that law enforcement officers often have to work second jobs or work with two different agencies just in an effort to make ends meet. This type of hazard pay being offered this time of year will help alleviate those worries and concerns. So again, thanking all of those individuals, the governor, Colonel Ginn, and all law enforcement. We appreciate what you do. And I'm going to turn it over to Trooper Craig James and let him talk about the impact that it's had on he and his family, knowing that this hazard pay is coming at this time of year. Trooper, thank you for your service.
Thank you, Commissioner. Again, like the Commissioner said, it's very humbling that the governor would have thought about us this time of year to give us this money to help kind of offset some of the costs that come with the holiday season. It will help out tremendously. My wife has been picking up extra shifts. Maybe she can knock that back a little bit with this money. I want to thank the governor and thank the citizens of the state of Mississippi as well for this kind and generous gift. Thank you.
Thank you, and thanks everyone for being here. Before I open it up for questions, there's one more group of people I'd like to thank. And that's the family members of our law enforcement officers. Just like these men and women who put on the uniform every day, their families often don't get the recognition that they deserve. To all of our state's law enforcement families, thank you. We are deeply grateful for all of your sacrifices and for sharing your loved ones with us. Without your love and your support, they wouldn't be able to work as hard as they do to keep us safe. It's been a great honor for me to stand alongside these brave men and women today to recognize their selfless service and their dedication to the great state of Mississippi. I look forward to our state standing shoulder to shoulder with them for many years to come. With that, I'll be happy to answer any questions that y'all have. Emily, we'll start with you.
Governor, I wanted to ask you if you have numbers on how many officers will be receiving this pay and what's the total price tag for it?
Yes, so this pay is applicable to all sworn law enforcement officers that work for the state of Mississippi. There's approximately 1,750 of them. Obviously, we are getting final numbers as we move over the next couple of days, but approximately 1,750. We are going to, this gets a little more technical than people really care, but we're going to also pick up the tab for the fringe on that $1,000 in hazard pay, so that the actual $1,000 actually it's a little more than that, but that's what actually gets in their pocket, and it is applicable to all of those who work for the following state agencies: Attorney General, Auditor's Office, Department of Revenue, Gaming Commission, Mental Health, Department of Mental Health, Agriculture and Commerce, Department of Marine Resources, Department of Wildlife, Fisheries and Parks, Pearl River Valley Water Supply District, the Insurance Department, as well as, of course, the Department of Public Safety. A little over half of those certainly work at the Department of Public Safety, but all in total, there's approximately 1,750 across all state agencies. So somewhere in the neighborhood of 2.3, 2.4 million. Yes, sir.
Governor, recently a new caucus has been formed, the Mississippi Legislative First Responders Caucus, and I was wondering if you've been able to work with them or talk with them as they're getting ready for the legislative session to discuss possible pay raises for police officers here in the state.
Yeah, we've certainly had numerous conversations with individual members of the legislature over the last several months, and I think that there is a real opportunity to take this model of hazard pay, and I think when you think about our other men and women that wear the uniform in city and county government, I think this would be a model that could potentially be utilized to expand what we are able to do. Obviously, with the discretionary CARES Act monies that the legislature saw fit to give us in the governor's office, we were able to do this particular hazard pay. But there's been a lot of men and women in uniform throughout the state, in the city and county governments, that I would argue the legislature should consider. There's also a lot of heroes that are in the EMT world, and I think we should look at them as well as a potential way in which to invest more monies. I think it's something that that would be well received throughout the state, and I think it's a way for us to again say thank you. Make no mistake, these men and women don't work for the money. They don't get up and do what they do for big salaries or anything like that. But it is a way for us to show just a token of our appreciation during this season. Courtney.
Governor, I know I've heard the commissioner talk about it in the budget hearings, but wanted to know if you had any conversations with leadership or anyone over at the Capitol regarding extending the death benefit for the law enforcement officers who had died due to COVID.
Yes, we have had multiple conversations over the last several months. I am 110% supportive of that effort, and quite frankly, I think that most people within the Capitol are as well. So I would anticipate that that's something that should be able to get done and get done very quickly. I haven't had any conversations within the last week or two to suggest otherwise, so I think there's unilateral support for that purpose. Yes,
Hunter Dawkins with the Gazebo Gazette.
sure.
Thank you, Governor. This just quick question. Based on the start of the legislative session, do you plan on introducing this model included in your budget that you're going to present to the legislature?
Well, obviously the legislature has $1.8 billion in monies from the ARPA bill that passed in the Congress. In addition to that, we collected over $1 billion more in total revenue in the fiscal year that ended June 30th and was originally budgeted against. In addition to that, in the first 5 months of this fiscal year, in July through November, we collected almost $500 million more than was budgeted against. So the legislature literally has billions and billions and billions of dollars that needs to be allocated, and they are all aware of my strong desire to make sure that we invest those monies in opportunities to reward and to thank and to provide hazard pay for law enforcement officers. And they also know that we've got a unique opportunity with those state and federal dollars to do exactly that. We also have a unique opportunity to invest in our future. And I heard Lieutenant Governor Hoseman say recently, and I just met with him, I believe it was last week, and he and I are completely on the same page in that for the investment of these dollars, we want there to be multi-generational effects. This is not just to change things for the next year or two, but for the next year, 1 or 2 generations. Yes, ma'am.
Bobby Harrison has a question.
Great.
Governor, just explain the mechanics of how the CARES Act money works. I mean, I thought that, and I guess I'm obviously wrong, but I thought that money had to be spent by now. How much more do you have? Or is this all of it? And do you anticipate spending how do you anticipate spending the rest of it if it is? And if I may ask a follow-up question, just got away. We all appreciate and honor law enforcement, but in your opening comments, do you not acknowledge that there's been mistakes made by individual officers or that have that should not go unnoticed and questioned and even prosecuted over the past several years?
Yeah, so I'll answer both questions, Bobby. Merry Christmas to you, by the way. The initial question, the remaining discretionary monies at our disposal are just less than $5 million, and they will, including this, will be spent by the end of this calendar year, so before December 31. And so this is one of 3 or 4 things that we're spending these dollars on as we move towards the end of it. With respect to your question earlier, I certainly acknowledge that there have been mistakes made. There have been instances in which mistakes were made. There have also been instances where 1 or 2 or 3 individuals made bad decisions, and in some instances may have been bad people to begin with. That happens sometimes. But there are literally 700,000 sworn law enforcement officers across America. And there have been those politicians and there have been those talking heads across America over the last couple of years who've tried to take all 700,000 of them and throw them in the same briar patch with 1 or 2 or 3 individuals that have made mistakes or may have even been bad people. And I think that's where I want to make sure that we differentiate that the overwhelming and massive majority of men and women in law enforcement are in it for the right reasons and do a fantastic job every single day making sure that our communities are safe. Yes, sir.
Governor, several health officials are warning that we could have a new surge in infections from the Omicron variant. I'm just curious if your office is doing anything to prepare for the new variant and make sure that people remain as safe as possible.
Yeah, I think that it's certainly something that we should point out when those of us in the Sun Belt, in the southern states, in July and August went through a very significant surge. You may remember that there were a lot of those individuals in the national media. I'm sure none of y'all were guilty of this, but there were those in the national media that decided that this entire surge was based upon individual decisions that were being made by Mississippians and or by decisions that were made by the governor of Florida, the governor of Texas, the governor of Mississippi, and others. Over the last 3 days in the state of New York, they've had over 20,000 reported cases per day in each of the last 3 days. New York's about 6 times the size of Mississippi. What I would submit to you is and they have some of the most restrictive restrictions in the entire United States right now, but yet this virus is continuing to spread. And their hospitals in that state and many other states are under extreme pressure today. And that's certainly something that I suggested and predicted 3 or 4 months ago, and it's unfortunately for those good people in the Northeast, they're seeing it as we speak. With respect to the new variant, and yes, I've had conversations with our state health officials within the last week, and we don't have full data yet to make final determinations, but it seems the early data and even some of the anecdotal comments from some of the physicians in South Africa and other places, this particular variant is highly contagious, perhaps more contagious than any other variant that we've seen, and is going to spread in the United States very quickly. I don't think that even today that this Omicron variant is the primary variant in, for instance, in the Northeast. I think they're still dealing with their Delta spread, but that is going to become the primary variant in the U.S., and it's going to spread quickly in a lot of different places. And so we are certainly monitoring it very closely. The other piece of evidence that is certainly not final yet, but not only does it seem that it is probably more contagious than any other variant that we've dealt with, it also seems that the virus is slightly less damaging to individuals. The viral load, etc., seems to be harming people at a slightly lesser rate than some of the ones that came before it. And it also seems fairly clear as you look at the evidence, just as we saw in the surge in the Delta variant in the late summer, that those individuals who are vaccinated are faring much better than those individuals who are not. And so Mississippi now has just shy of 1.65 million Mississippians that have received at least the first dose, just shy of 1.5 million Mississippians that have received at least 2 doses, and then some number that have received both of the first 2 doses and have even decided to get a third dose that some call the booster, and then now there's conversations around whether we should call it the booster or not. But clearly those who are vaccinated by and large are faring much better. And so just as I have done throughout the outset, if you have chosen not to get vaccinated to this point, I would encourage you to talk to your doctor and see if that might be the best choice for you. As a state, we're going to continue to have the same approach that we've had throughout this pandemic, and that is one in which we know that we must protect the integrity of the healthcare system in our state, and we are willing to do whatever is necessary to protect that integrity. Everything from what we had to do in August and September to go out and hire literally over 1,000 healthcare professionals. When I ran for governor, I never had any inkling that I would be in the business of hiring nurses and doctors and respiratory therapists. But that is, we found ourselves in a position where that became necessary, and we did what we do, and we stepped up and worked through the Mississippi emergency management process and worked with our state health officials and went out and literally within days got over 1,000 healthcare workers in our hospitals throughout the state to relieve some of the stress. Yes, sir.
Governor, we're a couple weeks away from the legislative session beginning in 2022. Do you have any, what are your priorities for that session?
Well, clearly, we've got a lot of work to do during this legislative session. We have when we issued our executive budget recommendation, we took great liberties to convey during that time what our priorities are going to be, particularly with respect to the spending of state dollars. We're going to continue to do various things. I was very pleased to see that in the legislative budget recommendation that the the Mississippi Legislature, at least that particular committee, agreed with our attempt to hire more law enforcement officers at Capitol Police, for instance, to continue to police the Capitol Complex Improvement District. We're going to continue to work with the leaders on a myriad of things, and we'll continue to have positive results, I hope. Yes.
Bobby Harrison has another question.
Great.
Hey, Governor, Merry Christmas to you too. And just one quick follow-up. You said there was, I think, around $5 million left in the CARES Act money. How are you going to spend it? And you have to spend it by the end of this calendar year, I think you said. So how are you going to spend the rest of it?
Yeah, I'll get you a list of what we're going to do with the rest of it as that becomes finalized. As you can imagine, a good bit of it is going to be spent in in ways in which we are able to help fund some of the increase in overage of expenses in state agencies that primarily report to us, but not entirely. For instance, we're going to spend $688,000 for an example for the Mississippi Department of Child Protection Services to pay for expenses incurred during the COVID-19 state of emergency to provide the frontline services to Mississippi families and at-risk children. As you can imagine, CPS is an area that we haven't spent a lot of time talking about in the first 2 years that I've been governor, but that doesn't mean that we haven't spent an enormous amount of time working with Andrea Sanders and her team to get that ship turned around. And I got to tell you, they are doing phenomenal work doing so, even though I'll also let you know that this has been an extremely challenging time to do so, because obviously it is critically important that those individuals have the ability to meet with those families and with those children that ultimately come into their custody. They're doing fantastic work, and it cost an enormous, it was a very large increase to their overall budget to deal with the unique challenges that COVID brought for that particular state agency. And we're going to make sure that we reimburse those expenses, because we want to show that we are, not only is it a good faith effort to work with the plaintiffs in the case that we are dealing with, but it's also sincere, and we want to make sure that we have the adequate resources within the Department of Child Protection Services to take care of every one of those young kids. And so that's an example, but Bobby, we'll get you a list, and thank you for the question. Yes, sir.
Governor, for a question actually for any of the law enforcement that are here, I was curious, what has it been like for the past nearly 2 years to serve during the coronavirus pandemic?
Do you want to speak? Go ahead.
Much of the same as it always is. You know, we buckle down and do the job, no matter what. Sometimes that entails maybe wearing masks. In and out of that, and just doing the job as always. Yeah. So.
And I want to mention, oftentimes they were called to show up at COVID centers. They answer calls at night into homes that might have issues with families, and they're going into those areas often not knowing what they're getting into. I mean, COVID could be rampant in that home, and they're exposing themselves. And if you look at the numbers of law enforcement officers and first responders that have died with COVID over the last, since the pandemic began, we're going to be approaching around 50. And that's a rather large number. And if you look at it across the country, it's a rather large number. And particularly when this COVID started coming out and there were so many unknown variables, they answered the call each and every day, because it's not a job that sleeps. It's not a job that can work remotely. They show up and they put it on the line, and a lot of them have made the ultimate sacrifice, and that was to the point about the death benefit claims. That's why it's so important that those get paid, as well as this hazard pay. So I can tell you, in talking with law enforcement officers from across the state, it weighs not only on them, but their family, and it's been a very difficult and trying time.
The figure that you just mentioned of 50 law enforcement officers, is that just Department of Public Safety officers, or is that sheriffs, police, other levels of law enforcement?
That's other areas of law enforcement based on a survey that we requested. We sent out a request to the Sheriff's Association, police chiefs, and the fire associations asking for any numbers that they had of members of their associations that had died with COVID over the last couple of years. About 2 months ago, the number was in the mid to high 30s, so we anticipated it being close to 50 by the time the year ends.
Governor?
Just a quick clarification also, and this is one of the reasons that we haven't been able to do this yet. You know, when you talk about the death benefits plan that was set up, it was set up while I was Lieutenant Governor. That particular plan has some restrictions and some limitations as to who qualifies and who should, and so that's one of the reasons it's very important as we get into the legislative session that we have the ability to make some tweaks or maybe set up a new fund for those with COVID, but we want to make sure we get the money in the hands of those families who need it. Yes, ma'am.
Governor, do you plan a similar tribute such as today for like the thousands of nurses and doctors, other medical professionals who have like truly borne the brunt of the pandemic?
Yeah, we've had a lot of healthcare heroes. There's no doubt about it. You may recall that during the Christmas season last year, we actually, in our entire theme of our Christmas decorations within the Governor's Mansion was to honor those healthcare heroes. We literally have thousands and thousands of nurses and doctors and respiratory therapists and others all across the state that have really stepped up and done great work, and we commend them for doing so. And so we think that's a extremely important thing to say, is that those men and women who wear the uniform for the state, so that 1,700 or so that I mentioned earlier, is one piece of the heroes that have stepped up, but it's not the only piece, and it's an important piece, but not the only piece. Yes, sir.
Last week, the Legislative Joint Redistricting Committee voted to recommend that the full legislature approve a new congressional map. I'm just curious if you've seen that map and just what your thoughts are about the map, and if the legislature does agree to approve that map during the beginning of the session, if you would also.
Yeah, I haven't personally seen the map yet, so I'm not going to comment on the specifics. But once I see it, I will take a look at it and we'll decide at that point. As a reminder, the executive branch has a role to play and there are statutes which lay out what is required of the legislature in drawing the congressional maps. With respect to the legislative maps, the executive does not have a role to play. They draw their own maps, and I'm watching it very closely because there's certainly always litigation around each and every one of those. But I'm going to withhold comment on the congressional map until I've had an opportunity to personally see it. I have not yet seen it.
To review it, to look at it?
Hopefully sometime between now and when the legislative session starts. Yes, sir.
Sir, I know in terms of the state legislature and medical marijuana, you said in the past that you want certain limits put in place before you sign off on a bill on that. Has anything changed since earlier in the fall, or you have the same stance?
No, as I have said many times, I think those individual legislators who worked on the marijuana bill, and I know they want you to call it a medical marijuana bill, but I'm going to call it the marijuana bill as it currently exists. Those individuals who worked on it made a lot of improvements to the initial draft, and I commend them for those improvements. However, as it currently stands, an individual can get a marijuana card by going to their physician, and if you look at the state of Oklahoma, in the state of Oklahoma, 10% of all residents in Oklahoma have a marijuana card. If 10% of all Mississippi residents get a marijuana card. If we just aren't more apt to do it than Oklahoma, but just similarly apt to do it. And if you look at our demographics, there's some similarities. But if 10% of Mississippi residents get a marijuana card, that's 300,000 Mississippians will have a marijuana card. Under the law, in its most recent draft, you can get up to 3.5 grams of the product. Now, the proponents of this particular bill love to talk about grams, and they love to talk about all these other things that nobody fully understands. But if you look, and you don't even have to be that good, it's a pretty simple Google search. 3.5 grams would allow for all 300,000 Mississippians with a marijuana card to get up to 11 joints a day. 11 joints a day. It is my view that when you allow 300,000 Mississippians to get 11 joints a day, or approximately 3.3 million joints a day, or almost 1.2 billion joints over a year, that at some point that has become no longer medical marijuana, but recreational marijuana. If there are 1.2 billion joints floating around Mississippi in any one year, I believe that is no longer medicinal. It is no longer for the purpose of helping those who badly need it, and it becomes recreational. I think when you have that many joints available to Mississippians, you're going to see significant side effects, not only to those individuals, but side effects to society as a whole in Mississippi. I think you're going to see it's going to be even harder, for instance, to fill jobs in Mississippi. I think it's going to be even harder to get individuals that we already have a labor shortage in our state. We already have a scenario in which those able-bodied 18 to 65-year-olds, their workforce participation rate is lower in Mississippi than in any other state. I think that's likely to get worse, not better. And, of course, I think the crime and other things that go along with it, I think, are likely to go up. I predict that if the bill passes in its current form, that it's the day that it is its most popular, both amongst Mississippians in general, as well as for those Democrats who vote for it, and I think the Democrats will vote for it by and large overwhelmingly, and for those Republicans that choose to join them, I think it becomes less popular every day after it passes. And so what I've encouraged them to do is to recognize that maybe 1.2 billion joints is too many, and significantly reduce the total amount of marijuana that can be received. So far, we've had conversations regarding that. They don't seem some of the those who have done the negotiating have not seemed likely to want to do that. But we have a legislative process, and I'm hopeful that there are those that will recognize what 11 joints a day will do in our state, and will hopefully offer amendments and do other things to change that. So, yes, sir.
Oh, me, sorry. But so what would you prefer that the gram that the amount be reduced to? I mean, what would be your idea area?
Well, my preference would be that we had a true medical marijuana program in our state that helped the several thousands of people who truly need medical marijuana that have a physician. My preference would be that we had, like we do with every other medical drug, a pharmacist involved. My preference would be that, should that not be possible, that we significantly reduce the overall number of overall amount of marijuana that's made available. And so there's a number of different ways to skin the cat. But given the current bill, if they significantly reduce that 3.5 grams to a level that I could live with, then I could sign a bill. But as it's currently written, I don't think I'm going to be able to do that.
Governor, the FDA has recently approved a measure that allows for the mailing of abortion pills do you think the state will be limiting access to that in the future?
You know, I saw that the FDA did that. It's yet another example that in this administration there is nothing that is not there's nothing that is off limits to political decisions, and we'll deal with it as we move forward.
Governor, I wanted to ask you the basis of the swipe that you just took against Democrats on the medical marijuana. The people in charge of negotiating this, as you know, are Republicans. What is your basis?
I'm just my only basis, Emily, is that I expect that the Democrats in the legislature are going to vote for this bill, and I expect because they've been supportive of similar legislation in the past. They've filed similar legislation in the past, and what I expect is that there are going to be a large number of Republicans vote for it as well, but I think there's also going to be a large number of Republicans that vote against it. And so, you know, we'll see what happens as we get to the legislative session. I'm hopeful that we can find at least 18 senators and 44 or 45 House members that are willing to vote against it, so that we can negotiate a true medical marijuana program in our state. Because I really do believe that as these green buildings start going up in communities in every opportunity around the state, this thing is going to become a lot less popular every single day after it passes. And so when it comes to this particular bill, if there are a large number of Democrats who want to vote against it and want to vote to sustain a veto, we would welcome that.
Another question about the session. Will you support efforts to revive the initiative process?
Sure. Yeah. I think that's I think that access to the ballot is important. I don't think that one person writing a $2 or $3 million check on any one issue and to put it in our state constitution is the correct way to do it. But I do think that the citizens should have access to the ballot, and it ought to be done in a way where it's challenging to get on the ballot, but that it's possible.
And I know a lot of people have called for a mechanism to amend the state code, to amend state law as well as the Constitution. What are your thoughts on that?
I think that's certainly an avenue that the legislature may take. It certainly seems to make sense to me that you amend statutes and you let your voice be heard rather than putting things like marijuana in the state constitution. I'll give you an example. I mean, there's no question that there are a lot of people. In fact, even if, in my view, even if you are pro marijuana, even if you're pro recreational marijuana, it seems to me that should be in statute, not in the Constitution, long term. And plus, it also is a way in which to do it. Look, we live in a form of government more as a republic than as a true democracy. If we ran everything as a true democracy, we would be in a state called California, where 50% of the voters go to the polls and vote for one thing, and then the same electorate goes back to the polls and votes not to fund whatever it is that they voted to do, and it really creates chaos, and it's very difficult. By and large, we elect, in our state, we elect every office holder at the county and city and state level, and so I do think people should have access to the ballot, but I don't think we should have 4 or 5 ballot initiatives every time we have an election. Well, look, thank you all for being here. Thank you all for the questions. If I don't see you between now and Saturday, please have a Merry Christmas, and we'll talk to you soon. Thank you. Thank you all. Appreciate it.